Hey, good morning, y'all. So it's time with Tisha, mornings with Tisha, and I am answering another question that I have gotten. And this question is surrounding how do you support or help a family member or a friend who is dealing with mental health challenges. So, the first thing I want to invite you to do, if this is you, I want you to make sure that you are good. I want you to make sure that your mental health is well, right? That you have the support and the things that you need, and that you are in a good place, because dealing with someone else's mental health space can be very difficult when you are struggling with your own things, right? And so we just want to make sure that you are okay. And then after that, depending upon, it really depends on what the mental health challenge is, but for the most part, it's finding ways in which you can support the individual. What does the individual define support as? And is it within your capacity and your ability to support them in that way? A lot of times it really is just listening and understanding and positioning yourself to be in that space to listen and to hear. But depending upon what the actual challenge is, that may not always be received, right? There may be other things that they're in need of, and the severity of the issue. And so it really depends on, I would recommend doing research if you know particularly that there is a diagnosis and what that diagnosis is. You definitely want to research it. You definitely want to see just some generalized, you can chat GBT it, you can Google it, or pick up a book about it, listen to a podcast about it, how you can be supportive in that space. Definitely, if the person is open to, if they have shared that this is a mental health challenge that they're having and they're open to conversation about it, then just being a listening ear and being supportive and asking them how you can support them. And then also, where your well-being comes into it is making sure that you have the capacity and the ability to support them in the way in which they need it. The other thing you can do is, if they haven't shared the mental health challenge, but you're just observing that this is a space that they're in, then researching, making sure, depending upon how this is impacting you, making sure that you're okay, you have a safe place to talk and to land, and a support system for yourself. That's really important. As you are being a support to others, you need to have a support system for yourself. A lot of times we want to give and give and give, and our cup is already empty or our cup is almost empty, and so we're giving from the very last bits of what we have, and then we find ourselves in a space where we're really struggling, right? And so we want to make sure that I think all giving should come from a place of overflow. But if we're not in a place of overflow, at least allowing our cup to be filled on a regular. So it's going to be really important that you fill your cup. What I do want to remind you is that we are not responsible for the mental health of other people. Individuals are responsible for their own mental health. We can be supportive in that process, but the individual has to take accountability for their own health, right? The progress that they want to make, the improvement that they want to make, the changes they want to see occur, all that is an individual thing, right? Individual decision. So being supportive in that space, but also recognizing your own personal and individual limitations. And just keep on loving on folks, and from a Christian perspective, we can definitely incorporate those things, as well as praying for individuals, praying for their strength, praying for direction, praying for insight for ourselves and how we can show up better. Praying, right? Pray for your brother and pray for your sister. All right, y'all.